We've got the guys now that we're treating on the other side of the hall, and they're staying hard older and longer, and we've got the ladies having painful intercourse, so we had to do something for them.
We can inject PRP all over the body.
I think it's something that most people benefit from. We all need PRP somewhere.
Hi everyone, and welcome back to another episode of Beauty in the Brain. We're so excited that you chose to listen to us today. We are the podcast that talks about all things aesthetics. I'm Dr. Chris Croley, one of your co-hosts.
And I'm Jerry Drinkard, a family nurse practitioner. Today we're going to be talking about some exciting things, including liquid gold. So everybody wants to know, like, what is PRP?
Yeah, we get that question a lot, and actually that was a question that was submitted through one of our groups to talk about is, what is PRP? Do you want to tell our listeners what we're going to be talking about today?
So PRP is platelet-rich plasma, and it's derived from your own blood. So a lot of patients don't know how we get PRP or how the PRP is processed. In our clinic, we draw blood from a patient, whether a 60 cc draw, a 90 cc draw, and we spin this blood, we separate the red blood cells out from the plasma, and then we respin the plasma so that we get a dual spin on it, and we get the most clear form of platelet-rich plasma, the plasma that we can get. And then we reconstitute it down to whatever we may need, and then we inject it, depending on what area we need, what we're treating. So it can be used for a lot of stuff. You want to dive into that a little bit?
Sure, I'm happy to. So we can inject PRP all over the body. So we're going to be focusing today mostly on facial aesthetics and talking about what we can do for improvement of anti-aging features on the face. But we really can inject it all over. We can inject PRP for hair rejuvenation. We can inject it into the penis for erectile dysfunction, into the vagina for some painful intercourse, stress incontinence. Other specialties are using it for joint discomfort, joint pain, wound healing. So really it's a regenerative therapy that uses your own plasma in a variety of ways to kind of harvest those growth factors and stimulate wound healing. And we're using it in aesthetics in a way that we kind of trick the body into thinking there was a wound where there wasn't one. And in the process of healing that, we're going to stimulate a lot of collagen formation.
Right. Probably some of the most recent and the most popular PRP treatments that people recognize by name is the vampire facial or vampire facelift. And so you want to talk a little bit about the difference in that, because a lot of people may not know what it is or what it's the purpose it serves.
Sure, and we've got that question a couple of times through our social media channels. So the vampire procedures are procedures that are kind of trademarked. They were invented by Dr. Charles Runels, and that's who we originally trained with many years ago and still do those procedures to this day. And so he was really kind of, a visionary or a pioneer in this arena when he started using this PRP for different things. In the beginning, it was used just for joint treatments, joint therapies. And he started using it for collagen stimulation and some anti-aging treatments in the face. And when we talk to patients about vampire facials, we're really using this in a way that we're combining just PRP alone with some sort of needling device. So we're doing a micro needling and we're putting PRP on with that. Maybe we're using it with some sort of hyaluronic acid, like topically, or some sort of serum, but we're really not injecting it in any fashion. When we talk about a vampire facelift, what's different in that and the facial? The facelift is when we're combining the PRP with a hyaluronic acid filler. And so we're injecting the filler in very specific points to create a lift. And so as we age, we know that kind of the fat pad shift in the face, we lose fat in certain areas, it moves to other areas. And so we're going back with the filler and kind of replacing that volume and at very specific points. And then we're going in after that and injecting the PRP in addition to that to stimulate collagen. So we're putting a filler in initially to give you the immediate result, and we're using the PRP to kind of like generate more collagen and give you a sustained result.
You know, we've talked on previous episodes about the dangers of injecting some of the HA fillers, hyaluronic acid fillers. And so with the PRP, we don't face some of those dangers as far as the vascular occlusions. So do you view it as a safer treatment option for patients?
Yeah, I do think it's a safer treatment option. I think it's a myth to think that you can perform PRP or PRF treatments and not have any risk of vascular occlusion, but I think that it's small in comparison to hyaluronic acid fillers.
Well, I think the occlusions are different with PRP. You can have a compression occlusion. So if you put enough PRP in any particular area, you do run the risk of having that compression occlusion. But it's very rare because if we inject into a vessel, we're basically putting blood back where, or plasma back where it came from. So I think it's certainly a safer treatment option. For me, myself, I've had both HA filler in my tear troughs, for instance, and I've had PRP. And PRP is certainly my go-to option from this point forward due to a complication that we had. And I trust Chris to the nth degree. And I've had
He trusts me, but he's calling me out on the podcast that I was the one that injected his tear trough
he
filler.
did inject my tear
and I
trough.
did block some lymphatics inadvertently in the
And
lateral
he did
portion.
it with a blunt tip cannula.
Yeah.
And so, I mean, we took all of the safety precautions that we could have taken, and I still ran into a complication that we probably wouldn't have had we used PRP to start with. But I just wanted I was in my mind, I wanted to be a little more aggressive. As far as the PRP, what about PRF? That's also something that's out there now.
Yeah,
We've gotten some questions about the difference in the two.
Yeah, it's a really hot topic in aesthetics. And so PRP is platelet-rich plasma. PRF is platelet-rich fibrin. Platelet-rich fibrin's also been around for a really long time. So with PRP, to collect that and process it and administer it to the patient, we usually have some kind of blood thinner in that. It's something that keeps it from clotting or forming a clot so we can re-inject that. That does cause a little bit of burning from the patient perspective. So if they're receiving this procedure, it may sting a little bit. With PRF, we're not putting any sort of preservative or anticoagulant or anything in the product. It's just the blood. It's actually processed and being spun in the centrifuge at a lower speed than we're doing with the PRP. And the idea is that by not putting an anticoagulant in that it will form more of like a gel-like or a clot-like once it's injected, and that will give you a slow release of growth factors over several days or weeks compared to more of the immediate release of growth factors that we'll get from some of the PRP that we inject. There's not a lot of hard science that shows that one is superior to the other. And in fact, a lot of the science around PRP is heavily debated. So I can tell you anecdotally, our patients are very happy with their results. We have high patient satisfaction, low risk for these procedures. And definitely when we look at before and afters, we can see improvement in things such as their wrinkle severity score, their skin pigment, skin tone. Those things will improve over time. And we don't see a difference in that really with between PRP and PRF. But the idea with PRF is that we're going to inject something that's going to stay there for a bit and then dissolve over a slow period of time. We are fortunate. We have both capability of doing both in our practice. So we have a number of different PRP and PRF systems in our office. We do a ton of trainings, and so we want to be up to date and familiar with all the different devices that are out there. So you don't necessarily need all the devices in your office or in your practice, but just kind of educate yourself on the differences between the two. If you're an injector, I think one of the biggest things that's different between the two is you have to be prepared to inject the PRF relatively quickly, because if we process that and we're not ready to inject right away, it will form a clot or too thick of a gel in the vial, and we won't be able to re-inject that.
And I think from a patient standpoint, that it's important for patient education to let that patient know that there is going to be a period. You and I have always kind of referred to it as buyer's remorse, because there's a period 2 to 3 weeks in that you basically go back to your baseline. You don't look like you've really had anything done. We're talking about patient satisfaction, and I think the patients are satisfied as long as they know that it's going to take a bit to see their results. And so as far as we talked about the safety, but what patients would you not consider doing PRP or PRF in?
Yeah, so we have to really take precautions with patients that have any kind of blood abnormalities. So if they have any kind of clotting disorder, any kind of platelet dysfunction, or any sort of malignancy, especially any kind of the blood things, so it's leukemias, CML, AML, all those sorts of things we would take into consideration before we would inject or draw and process their PRP. Other than that, it's a broad range of patients this is really safe for. But safety is one thing, results is another. And so because we're depending on the body's ability to really produce collagen and to improve these results, if we have somebody that has a really kind of poor lifestyle habits, such as smokers, they're probably not going to respond as aggressively to PRP. And so I'd really want to talk to them about smoking cessation prior to undergoing this therapy to optimize their results.
So we talked about several different ways that it can be used for facial aesthetics, but there are also other treatment options that we can do with PRP or PRF in other parts of the body. So during COVID, we saw a lot of post-COVID patients with hair loss. We treat a lot of perimenopausal, postmenopausal women that have hair loss. So a lot of males that are on testosterone therapy that have hair loss or just genetic hair thinning. So that's another option for treatment as far as hair loss. How do you recommend doing the plasma for that? Would you recommend PRP, PRF, combination?
Yeah, so we've really had great success in our practice with PRP. We use a double spin system, which is a type of system that processes this blood that we draw. It spins it twice. So the first spin, we kind of get rid of the red blood cells and some of the things that are really inflammatory. And then the second time we process it, it really helps separate out those growth factors from the plasma portion that really doesn't have a lot of the growth factors, because that's really what we're going for. It's this area that the platelets live. It's right at this place called the Buffy coat, and that's right between the red blood cells and the plasma when we spin it. So we have had really good success with using this double spin system. Now I know there's a lot of reports out there and a lot of really successful practices that use PRF in those areas, and I think it's an acceptable alternative. It's not our go-to in our practice, so we use the double spin PRP a lot for hair therapies.
I know you have like a huge passion for PDO threads, and almost every PDO thread lift that you do, you combine the use of PRP with it. And I've heard you refer to it as being almost like a fertilizer for your threads. And as far as like hair growth and hair treatment, that's one of the combination treatments that we do commonly in practice is using PRP. What are some other areas that you may combine PRP with for enhanced results?
I really do love combining OPDO threads, and so we're using two different modes of biosimulation to really kind of create collagen. In addition to hair, one of my favorite areas to treat with this combo therapy is in the tear trough or the periorbital region, because when we treat around the eyes with filler, we can get an instant result. People love the fact that we can pop a filler in the tear trough region and get a really quick plumping effect, but there's a lot of side effects associated with that. So what looks good on Instagram for your immediate before and after may not look good a couple of weeks later. And I talk about this in a lot of the classes that I teach, and it's really interesting the different texts that I receive pretty commonly from providers that have decided to go ahead and put an HA filler because they felt pressure from the patient into the tear trough region. And then a few weeks later, they're having irregular lumps, bumps, they're having some swelling, edema, or bluish discoloration. And we just don't see that with PRP. That is it's a slower process, and so it is going to take months to see the results. So for me, when I'm talking to patients, I do talk to them a little bit about what you said about buyer's remorse. I tell them it's going to look great. We may even over volumize. It may look a little swollen or puffy for the next few days, and then it's going to go away, because we have to kind of keep in mind that plasma is mostly water. And so we're trying to get these little growth factors out of this, thing that has mostly water in it. And that's absorbed by our body over the few days after we inject it. And those growth factors are left behind to stimulate collagen growth. And so in that period where the water is absorbed and goes away and the growth factors are kind of doing their job behind the scenes, we don't really see anything. And so the patients are going to look a week or two later and think, did I really have a result? And I know you've heard this, I've heard this, we talk about it, and we've seen this happen now over, nearly, 8 or to 10 years, somewhere in that range is how long we've been doing this therapy, that patients will kind of forget about having it done. They'll almost think it wasn't effective, and then they end up going somewhere and seeing someone they haven't seen in a while, 3 to 6 months later after the treatment, and they ask them, have you changed makeup brands? Have you been on vacation? You look rested, you look great. And then they think back to the conversation and they realize that that's about the time frame they're starting to see results. And so I know that happened for me personally. It was one of the favorite things I did for my tear trough region. But at that time, we were using a different system, a single spin system, and we recommended 3 treatments 1 month apart. Do you want to just talk a little bit about how our treatments have evolved over time and what we're doing different now with a better preparation system?
Like you mentioned, we were initially in using a single spin system, and now we've had several dual spin systems, and most recently using a M-Site system that's a dual spin, and we get a very clear, very clean plasma suspension, and so that's where the whole term liquid gold comes from. So many of you may even see, I think the title of this podcast even is the liquid gold, and that's where the name comes from. It does look to be just a liquid gold. And so, a lot of times if you don't have a suspension that's clear, then you've accidentally gotten too many red blood cells in there, and you need to address, like, why are you getting this? Are you using the right system? Was your preparation done correctly? Because injecting those red blood cells will cause some discomfort to patients that they won't get with a good clear spin.
So yeah, I mean, it's a little bit uncomfortable then for sure. It definitely causes, and it does cause a little bit more inflammation. So in addition to the discomfort, inflammation, it's going to look like we've injected a bruise because those red blood cells, you'll actually see them a little bit. And some of this may be beneficial for some areas. So I mean, for patients have had this or providers are listening and they were trained to get a few red blood cells in there, it may have its place in some of the chronic pain patients, joint injections, et cetera, but we really don't consider that desirable in aesthetics. We try to get as many of the red blood cells out as possible. And so that's kind of why one of the things that pushed us to switching to the systems that we use now is to minimize the chance of that. We've had a lot of success in our practice with this outside of just facial aesthetics and a few other areas. And we'll have entire episodes on those areas, but why don't you just touch base briefly on where else we can use PRP?
So probably some of our most common treatments are PRP for erectile dysfunction or for sexual dysfunction in the female population. So we do the P shot for guys, and we've trademarked a procedure, the Performance P wave, which combines a sound wave therapy with plasma therapy as well.
Can I just stop you there just a minute? Because I mean, that's something that we're like really both proud of, that we worked a long time on that.
I thought you were about to scold me about something. I'm like, yes, you can stop me.
No, I mean, it's something that we took a long time to develop, and we did use research from a lot of different areas and a lot of different fields of medicine to really kind of come up with this. And it's not that you can't find other things out there similar to it, but we were the ones that developed the Performance P wave. So we developed it at our clinic at Skin and Tonic here in Pace and combined it with the P shot that we learned from Dr. Runels years ago. And so I'm very proud of it.
We saw that there was such a need, and there was such a desire for improved performance, and so it was not necessarily based on erectile dysfunction, but rather performance improvement. And so and I think that's the reason our patient population isn't strictly an erectile dysfunction population with our male sexual health. It's younger guys that just want to be better. They just want to be bigger. They want to be harder. They want to last longer. They want to have more intense orgasms. They want to be more sensitive. And so all of those things are things that really enhance a sexual aspect of a person's life. And that's such a big part of what we are as people. And so, and leading from that, we have the Vagicadabra, which is our female sexual health platform that we've trademarked recently. And for that, we have, plasma therapies also that we can do for vaginal moisture, for vaginal dryness. That's very common with these people going through hormone changes, or for painful intercourse. And we've got the guys now that we're treating on the other side of the hall, and they're staying hard older and longer, and you've got the ladies having painful intercourse, so we had to do something for them. So we've got it helps with the stress incontinence. It helps with painful intercourse. It helps with vaginal dryness. And so all of those things are things that are done with PRP, and they're relatively simple treatments. They're painless. You're in and out. There's basically no downtime. And so I think it's just something that people don't realize that's available out there that can be done with your own blood. and as simple as an hour visit, you're done.
Yeah, so I mean, I think that's the great thing about it, and why I even wanted to bring it up on this particular podcast is to show that it is used throughout the body for a variety of conditions, and it is very, very safe. So we can use it in all those areas with very, very little risk of side effects. Definitely screening patients for appropriateness is, you have to do that. There's no way around it. So it's not something you can just come in and order off a menu and get. So we've got to make sure that it's appropriate, and that the conditions we're trying to treat are actually appropriate for this type of therapy, but the treatment itself is very low risk. So for facial aesthetics, it's one of the things that we have incorporated in our practice almost from the very beginning. It was one of the first devices that we received. And in terms of combining it with therapies, we talked a little bit about combining it with PDO threads, combining it with filler for the vampire facelift. But it's something that we also combine a lot with our laser therapies. Do you want to talk about the benefits of that?
Yeah, it promotes healing. It decreases downtime. We have some ablative lasers and some that are not ablative, but there's still downtime associated. And so the use of PRP and the combination of those therapies really makes a big change, a big difference in that heal time, and it can cut the heal time in half with some of the lasers. So so one of the things that you mentioned briefly about an inflammatory process, and so that's one of the post-care treatments or post-care instructions that we give patients is to be careful about taking anti-inflammatories. And so outside of trying, because it's all based off of this inflammatory process that we don't want to stop with the medication. So if it's a treatment that you're interested in, certainly we'll bring you in and do a consultation prior to. Be sure that you're not on medications that may inhibit the process, because we want our patients to have the best results.
Yeah. So if you're a patient out there looking to have a PRP treatment or any of the vampire procedures or PRF procedures that you may have read about, what advice would you give them when selecting a provider?
One of the first things I would say is you can go on the Vampire site and you can find a locator. You can put a patient in, find a provider that's certified. I personally would want a provider that used a dual spin system, just because of the quality of the PRP that's going to be used. And I'd want a reputable injector, someone that I trusted and someone that was going to stay with me through the process.
Okay. Yeah, I think those are good points. Certainly, you can go on the P-Shot, O-Shot, Vampire, Facelift, all of those sites to find providers who have been trained in that particular method. If a provider is not using those methods, that obviously doesn't mean that they're not doing things correctly. Maybe they're just not paying the trademark fee. So there's a lot of other things you can do with PRP and PRF without those trademark names. I think I would ask some of the similar questions that you mentioned, like what type of system are you using? Is it dual spin? Is it single spin? How many treatments am I expected to have? So I can tell you, for if you don't know the difference, a single spin means it's spinning it once and separating it. You may not get as many growth factors or platelets in the final concentration. And for that, we used it for a long time with great results, but we usually set patients up for a series of treatments. So they have to come in for 2 or 3 treatments, and we're seeing similar results with 1 or 2. So we're shaving off some of the treatments by using a dual spin system. So I kind of like that system better myself. So I would ask that information, ask their training, their credentials, and I would want to make sure that, but regardless of what they're using, whether it's a PRF, dual spin, single spin, make sure they're using a system that is FDA cleared for that particular purpose. So these procedures aren't FDA cleared, but you want to make sure that they're using a system and a collecting device that is approved for this type of use, to minimize the chance of any kind of infection or infectious complication that you would have from this procedure, because it is very safe.
I think it's something that that most people benefit from, and that we all need PRP somewhere, right?
You didn't mention when we were talking about the female sexual health is that it's an impact really on improved orgasm. Why don't you tell the story that you had a patient that...
We had a patient and she had difficulty achieving orgasms, and so she came in for treatment. We did her consultation. We completed her treatment, and we got a call from her, shortly after leaving, and she had her first orgasm when she hit the speed bump leaving the parking lot. So we had she's a satisfied customer. She'll be back. So it's like I said, it's a treatment that we can all benefit from. I'm sure she was happy, her husband was happy, and or whoever she went to after she left the parking lot was happy. So
thank you guys very much for tuning in this week to another episode of Beauty and the Brain. We hope you've learned a lot about PRP, PRF, what are the differences and why you would use one over the other. And we look forward to seeing you next week.